Hello kids, how are you all? Hope you are doing well. So, in the last class we were studying the chapter Why Do We Fall Ill? And today we are going to study the same, and our today's topic is diseases and their causes. So first of all, we will study what is a disease and where the word disease came from. So if we are talking about the disease word, so disease word is made by, you can say, addition of two words, dis and ease. Dis matlab without and ease matlab easiness. Without easiness, or you can say any discomfort in the body or state of uneasiness, discomfort or disturbed ease is known as disease. Here we can say that a disease is an abnormality or disturbance caused in a body. Got it? It can be defined as condition in which normal functioning of the body or its some part or organ is disturbed or deranged. Got it? So here the normal state of an organism represent a delicate physiological balance or homeostasis in terms of physical, chemical, and functional processes. And any imbalance or disruption in this balance leads to manifestation of disease. Got it? So here, disease is not, you can say, something which is in our environment. It is caused by some pathogens and all, which causes disturbance in the balance, physiological balance of our body. Like we are having fever. Fever mean to say we are homeostasis. So here the body normal temperature is 37 degrees Celsius, but when it increases, so we say we are having fever. When we are not able to do any normal function, so it means we are having any kind of disease. Like here, uh, I'm having arthritis and I'm not able to walk. So here arthritis is a disease due to which I'm not able to walk. Got it? There are few symptoms of the disease by which we can identify them. Here, we can say a disease is not caused by any external injury but can be caused by any external factor like germs and other pathogens, we can say. Sometimes integral, or you can say internal dysfunctionality of our body may also lead to disease. Integral or internal, we can say, like if our body is not producing much number of RBCs, it can cause anemia. Got it? A disease generally has some symptoms and sign associated with it. For example, it might cause pain, swelling, fever, a cough, or some other symptoms. Got it? So let's study symptoms and sign. Symptoms, you can say, manifestation of disease is in the form of some symptoms or some definite signs. Thus, a symptom is a change in the normal structure or functioning of the body system or body part. Every disease or most of the disease, generally disease, are associated with symptoms. In other words, our body shows certain symptoms or indications which we can assume that may be suffering from a disease. We all know that different parts of our body perform different functions, right? Any of these functions are disturbed, we can say that something is wrong within our body or something has changed in it. This is a symptom of getting disease. Are you getting it? For example, fever, headache, body ache, stomach, nausea, vomiting, all are symptoms indicating presence of some disease. These symptoms helps the doctor diagnose the disease, but symptoms do not provide exact diagnosis of disease. For example, headache can be due to fever, can be due to blood pressure or eyesight problem or stress or even any other thing. Got it? So doctors often look for signs of a disease in order to find the exact problem. The sign, unlike the symptoms, are a more definite indication of disease. Sometimes laboratory tests are also done in order to find a disease, so that it can diagnose correct disease. These are the signs and symptoms. Let's move towards the next topic here. uh, the type of diseases. Here we can categorize diseases in different types. So first we are categorizing disease on the basis of their severeness and time period. So here the disease can be classified here on the basis of their severeness and time period for two types. One is acute and one is chronic. So what are acute diseases? Acute diseases are, you can say, the diseases which are not much severe and they are for a short period of time. They appear suddenly, produce several symptoms for last which last, you can say, for short period. They last for not more than a week and do not have long term effect on our health, right? Example, we can say common cold, cough. If we are having common cold or cough, hardly it takes a week or two, right? In the same way, influenza, typhoid, cholera, diarrhea, malaria, these are few kind of acute diseases. So they do not affect our health, mean to say, it's not generally much weight loss or something, your health is totally degenerated and something like that. It's nothing like that. You can recover easily in few weeks or a month. But chronic diseases, these are the diseases which develop gradually and last for long duration, even up to several years or lifelong. They in some cases they cannot be cured completely and they might be life threatening. They can take the life also of a person. Their symptoms are mild but have severe effect on person's health. Example, tuberculosis. You might have heard some cases of tuberculosis in which tuberculosis has caused the death of a person. And this health is totally, you can say, uh, degraded. Like the person loses his weight, he becomes too weak, and here the he's coughing and blood is coming from his mouth, something like that, and he's not able to do much physical task, something like that. Diabetes in the person is not able to take, you can say, sugar, and the person is weak and can be affected, or you can say here can have many other problems with that. Diabetes mean to say the blood sugar level is increased and here the sugar is passing through its urine. Arthritis. Next is arthritis. In the arthritis, the person's bones become weak and joint pains a lot. The person is not able to walk properly for years, or you can say for lifetime also. Blood pressure. If the person is having blood pressure, the person uh, might have low blood pressure or high blood pressure, right? So he needs to take the proper amount of salt also, and he used to take care of his health a lot, and that can cause blood pressure. It can cause, you can say, many other problems also: heart disease, liver infection, kidney malfunctioning, cancer, AIDS, many more are there. These are the chronic diseases. Let's discuss chronic diseases. Actually, these are for a long period of time, but acute diseases, these are for short period of time. Acute diseases is caused randomly or are caused randomly, but chronic diseases are caused in a course of time. Next year, it does not cause major effect on general health. Acute disease does not cause a major effect on health, but chronic diseases cause. Example we have already studied. Here in acute diseases, tiredness is temporary, but their tiredness can be prolonged. Loss of weight, there is not much loss of weight in acute diseases, but in chronic it might. Actually, acute diseases have no prolonged effect, whereas uh, chronic diseases have prolonged poor health. And with acute diseases we can have complete recovery or cure, but here the cases are not same. So complete recovery or cure is not possible in every case. So how chronic diseases affect our health? Chronic diseases take relatively a long period of time, hence they are likely to affect our general health, as well as they may hinder to grow in our children or increase stress in adults, so they can pass from our generation to our next generation, that is our children. They can make us feel tired all the time. I told you, tiredness can be prolonged. They can also lead to increase or decrease in weight, affects the weight also, and affects the day-to-day activity. Hence they can have a long effect on our health. Okay, rest we will study in our next class. Thank you.